Hi, and welcome back to the Why-O-Myo podcast. This is Janine Stiene, your host, hoping to answer your questions about the who, what, where, when, why, and how when it comes to myofunctional therapy.
Disclaimer. All content, details, as well as education shared on this podcast are the opinions of the speaker and are for informational purposes only. Please consult with a certified medical professional regarding any questions or concerns, as this podcast should not serve as a diagnosis or replace the information received from a healthcare provider.
Hi, I'm so happy to be back. I've been spending some time on the road, attending and lecturing at conferences across the United States. I attended two really amazing conferences. One was put on by Sarah Hornsby and my own mentor called Inspire. The conference was made up of a diverse group of professionals that are all involved in the diagnosis and treatment of myofunctional therapy, for anything dealing with their freenom, looking into the best ways to predict what the future holds for myofunctional therapy. It was really inspiring. But beyond that, there was a great group of vendors that were present. And I think the most amazing part about having such a diverse group of vendors is that it's really showing how to be successful as a myofunctional therapist or to have a patient be successful with myofunctional therapy. It's not just about one tool, one opinion, one approach. It's truly about the patient and their symptoms and their needs. I typically use this phrase with my clinicians when I'm doing training, and I always say that myofunctional therapy is treating the problem, not just the symptoms. And again, in order to treat the problem and not just the symptoms, there definitely has to be a somewhat optimal environment, meaning that the patient has an open airway, there's nothing interfering, the patient has lingual range of motion, their freenom, their labial and lingual freenom are not restricted. All of those things are going to make a patient optimal for a myofunctional therapist. But what's important is that I do feel like we all, or even are so many of us, are under the misconception that I have to pick one tool. I can't use all tools. And in my practice, I always tell our therapists that the more you know, the better you are, the better suited you are to treat your patients. And it's very hard to do anything in its purest form. And that includes myofunctional therapy, again, in my opinion. I know some practitioners that, are very strict with their regimen and their practice. And not that we're not with our program in the centers, but we're more about, okay, I'm noticing that airway, that breathing needs to be, or they're a clavicular breather and they need to focus more on their diaphragm. I notice that when I'm having difficulties, that the patient is having difficulties following directions when I'm trying to give them the directions to do something appropriately, or maybe they need some additional work with strengthening their tongue, so we're utilizing replenish, or strengthening their lips, and we may be using button pulls and whistles and horns, and we could even be taping the lips and working on some restrictive type exercises. It is truly a large selection of items to be utilized. But I think every therapist, whether you're a myofunctional therapist or a speech pathologist or a body worker, a dentist, orthodontist, etc., I think it's so important that our patients are treated as individuals and we don't identify them as needing a service like myofunctional therapy and assume that every issue that they are presenting with that relates to myo or maybe doesn't, is going to be treated and addressed in the same way, because that's just not the way we operate as individuals. There's so much more to each of our patients than their diagnosis or their recommended treatment plan. And I do feel that the conference, at least going to Inspire especially, really allowed for the practitioners and the attendees to see that we're not working against each other. We're working with each other to meet the needs of our patients in the best possible way.
I hope I was able to give you some insight and answer some of your questions regarding myofunctional therapy. Please stay tuned and listen to our Myo Minute, and tune in to our Talk the Talk interviews with the many different medical, dental, and rehab professionals as they elaborate or answer your questions and address your concerns directly, especially when it's related to speech-language pathology and myofunctional therapy.